At your next checkup, your doctor will check your blood pressure. That's about a 20% mortality risk. They'll ask about smoking. That's 50%. But the American Heart Association has identified another vital sign that carries a 400% mortality risk, and it is almost never checked. The American Heart Association's own data shows that this single factor is a stronger predictor of whether you'll live a long and healthy life than smoking, diabetes, or high cholesterol. The problem is this information is not making it to your doctor's office. This gap in knowledge means that you might have a false sense of security, believing you're healthy when your most important vital sign is being ignored. So what is this vital sign? It's cardiorespiratory fitness as measured by your VO2 max. In this video, we're going to break this down. First, I'll show you a simple car engine analogy that reveals the real problem with only checking your cholesterol and blood pressure. And then we'll look at the specific data that shows just how big this risk factor really is. And finally, I'll explain the 3 powerful, specific answers you can only get from a functional fitness test. Answers that lead to a precise, targeted plan for your health. At a typical checkup, you get a list of risk factors. Your doctor checks your cholesterol and tells you that certain types of bad cholesterol can, in some people, lead to blockages. They check your blood pressure and tell you that high pressure can damage your arteries over time. But there's a big problem here. These are all guesses about what might be happening or what might happen in the future to your body. They are not functional tests. Here's a simple way to think about it. Your doctor is checking the fluids in your car, your cholesterol, making sure nothing is building up that could clog the system down the line. They're checking the pressure in the lines, your blood pressure, making sure the force isn't too high so that it could damage the pipes. But they are never actually flooring the gas pedal to see how the engine performs under maximum load. They're not pushing the system to its limit to test whether everything works together when you need peak performance. Cardiorespiratory fitness, or VO2 max, is that functional test. It's like taking the car to the track, redlining the engine, and testing whether the whole system, your heart pumping blood, your lungs transferring oxygen, and your muscles using that oxygen, can effectively work together to produce power when you need it. So what happens when we only look at the fluids and the pressure, but we never test the engine? We get a false sense of security. You might have perfect cholesterol numbers and normal blood pressure, but your actual engine, your body's ability to use oxygen, your heart's ability to pump, could be very weak. People with good risk factors can still have major health problems. Cardiorespiratory fitness is a stronger predictor of early death than smoking, high cholesterol, or diabetes. In one recent large study, the risk of death for people in the lowest fitness group was 400% higher than for those in the fittest group. This isn't a small difference, it's the single most powerful health metric we have. This brings us to the biggest problem with generic health advice. Your doctor might tell you to eat better or get more exercise, but what does that mean for you? That advice is based on averages, not on your personal biology. You're not given a precise plan because the doctor doesn't have a precise starting point. And this is the most important reason to get tested. A VO2 max test gives you 3 answers you can't get anywhere else. First, it finds hidden problems before symptoms appear. A trained expert watching your breathing pattern can spot early heart or lung dysfunction with a specific slope like your VE-VCO2 curve. And you don't have to get into details, but it can be spotted years before you'd feel anything, or anything would even show up in a blood test. This is something you simply cannot get from standard checkups. Second, it identifies your specific bottleneck. Is your heart not pumping enough blood? Are your lungs not transferring oxygen efficiently? Or your muscles not using the oxygen they're getting? Most people, and most doctors, can only guess. This test tells you exactly where your weak link is. Third, it creates a precision exercise prescription. Once you know your specific limitation, you get a targeted training plan that addresses your bottleneck, not generic advice like walk 30 minutes a day or do zone 2 or do HIIT training. This is the difference between guessing and knowing. So if this test is so powerful, if it can find hidden problems, if it can identify your specific bottleneck and create a precision plan, why isn't it a part of your yearly checkup? The answer is a mix of history and medical culture. For decades, this was seen as a fitness test for elite athletes, not a medical test for patients. And because of this, it's not a standard part of medical training. Most doctors don't know how to conduct the test properly, and even if they did, they don't know how to interpret the complex data. There's very little formal training set up for this. Most physicians who want to learn have to seek out training from non-doctors, exercise physiologists, Olympic coaches, and sports scientists. I've been doing VO2 max testing for almost a decade, and it took me years of learning with an Olympic coach to learn how to properly interpret the data and make targeted recommendations. And I'm one of a very small number of physicians who can do this. The test also takes time, often over an hour for me, which is impossible in a 10 or 20-minute office visit. And finally, our medical system is built to treat disease, not to optimize health. This means the system often misses the most powerful preventive tools we have. And so now that you understand why this VO2 max is the most important metric your doctor isn't checking, don't wait until you're already sick to find out where you stand. But getting a VO2 max test is easy. Understanding what your results actually mean is the hard part. I've made another video where I break down the hidden data in the VO2 max test results that most testers completely miss, and why detailed interpretation changes everything. Click the video on the screen to watch that next.